Now we see what are the recent and what are going to be the future developments in the field of medicine. You see, artificial intelligence. Artificial intelligence is being employed more and more in the healthcare system. You see, it provides a quick information about the patients. They provide a very quick insight using large number of data sheets. This data is processed by the softwares in the computers as the human cognition, and they can tell you about what is going on inside the patient, what is the possible disease, what are going to be the possible investigation, what are the possible support this patient is going to need. So that is being employed. Also, this helps the healthcare ecosystem in providing comprehensive patient care. So this is being employed more and more in the healthcare systems. And then you got virtual reality. Virtual reality is a situation in which an environment is created through the computers which does not exist actually. And the healthcare providers are made to live through this virtual world, and they have an experience of a virtual world in which they actually see as if they are performing the healthcare delivery in that system, and they can see through this helmet or head-held devices. For example, if the future surgeons are to be trained, they can be trained through virtual reality. They can be made to work in an environment which looks like as if they are working using the laparoscopes, and they are doing the laparoscopic surgery. So they can be taught on this. So this is a very good way of educating the future surgeons. And then the augmented reality. The augmented reality is that the existing environment is enhanced by using the computer-based methods. So this is another way of improving our service delivery to the patients. And this is in another field which is now growing, the augmented reality. It's different from virtual reality. In virtual reality, the situation does not exist. It is created by the computer. And augmented reality is that there is a situation which is enhanced or augmented by the electronic systems. And then you've got healthcare trackers and wearable devices. You've got these things, the Fitbits and the watches. They can acquire your data, and they can transmit this real-time data to healthcare providers, and they can make decisions about your health. And then you've got medical tricorders, which are handheld devices which may help patients diagnose their own internal conditions, and they can take their vitals. And again, this data can be transmitted to the healthcare delivery providers, and they can make decisions about your healthcare requirements. And then you got genomic sequencing, another important field which is developing, because if we've got a genomic analysis or the genetic analysis of an individual, we know what sort of genes are present in this individual. An example is that there was a drug which is used for the treatment of chronic hepatitis C, that is ribavirin. This drug ribavirin, although now used very uncommonly for hepatitis C patient, it can cause hemolysis in certain patients. Hemolysis means breakdown of red blood cells. So that can be dangerous for some of the patients. So we can find out through genetic analysis which patients are going to develop hemolysis because of ribavirin. So ribavirin can be avoided in those patients. So that can be very useful, that what sort of drug can be used in particular individuals. We can find out polygenic disease. Polygenic disease means the patient has multiple genes which may be involved in a production of a disease. And if these diseases are present, that individual can have this disease. Similarly, you can also find monogenic diseases. And you see, this is already being applied, for example, in nutrogenetics. So patients, we can decide what sort of nutrition may be useful for an individual. And then we've got drug development. So there is individualized computer simulation, which is used in development or regulation of drug, medicinal devices, or medicinal intervention. So this is another field which is developing. And then we've got nanotechnology. Already it is in, but I think future will be nanotechnology, because nanotechnology is in which very small particles can be sent to the site of actual pathology. So they can cause a reduction in the destruction which is caused by a large amount of drug being given to the patient. For example, if the chemotherapy is given to a patient systemically, it's going to cause problem in all tissues. If you've got nanoparticles which can reach the cancer site and deliver the drug there, so that can be used very efficiently to controlling the disease without causing a systemic problem. So there may be robotic, nanorobotic drug delivery systems, and there may be tiny surgeons as well. They may be causing, they may be doing delicate surgery at targeted areas, resulting in less systemic damage. And then you got robotics. There are surgical robots through which we can do multiple surgical procedures. And these surgical procedures can be done from a distance. They can be a telesurgery. And then you got disinfection robots. For example, these days you've got COVID pandemics. And when a patient who leaves that area, for example, of a room, that room and these different surfaces needs to be cleaned so that a next patient that can be placed there and he does not get that infection. So these disinfecting robots may be quite useful in these places, because if a healthcare person goes in, the chances are that he may not catch the disease. So that's why the disinfectant robotics may be quite useful. We can use exoskeletons. The exoskeletons are the gadgets which are used in patients who've got skeletal disabilities. So they can be used in those patients. And then finally, we got 3D printing, which is an important thing. You can have tissue printing, we can have artificial limbs, can have blood vessels. Virtually, we'll be able to have any tissue which can be printed using 3D printing and can be used for the requirement of the patient. So these are the different developments which are going on in the field of medicine, and the future or in the coming years, we may see the application of all those fields. So this is slightly different from the conventional medicine which we have been practicing, and the future we may see more and more use of these technologies, particularly the information technology or the artificial intelligence is going to be our future, in which we can not only diagnose the patient, we can also track the patients, and we can also provide the patient the opportunity to take charge of their own health. And if and when required, they can contact their healthcare providers if they land into a trouble. And you see, the data can be collected of large number of patients, and a lot of research or information can be derived from that data. So as time goes on, we will see the information technology and the artificial intelligence will be becoming more and more into the healthcare delivery system. So this is about the clinical medicine. It was just an introduction, and as we proceed further, we will see what are the different components. For example, what is history taking, what is physical examination, what is investigation, what sort of investigation provide what sort of help, and how do we use the cognitive domain of the brain. That is, how do we get the diagnosis from an information which acquires. So we will learn all this as we go along with these different type of we go along these different lectures. So now we close our lecture here, and we'll see you in future, inshallah, soon.